We're now going to go into one of these myths about long-term care, which is this idea that it's unsustainable to invest in long-term care. And we definitely think that this is a myth that is ripe for busting. And in order to do that, though, it's quite important that we understand what we mean by sustainability, because it's easy to say it, but actually there are lots of different meanings and aspects of sustainability that we have in mind when we make these assertions. I'm going to start just by sharing one slide, and this comes from my previous work on long-term care financing with other colleagues. So this was what I used to think of when I was thinking of a bit of the confusion about how we talk about sustainability in long-term care. And quite often what we find is that people talk about economic sustainability, but they don't really mean really economic sustainability. They might mean fiscal sustainability. And so I'm starting this to get the discussion started. I will then hand over to Roberta Perna, Martin Knapp, Jeroen Spijker, Andrea Schmidt, Nicole, Sutton, and Ludovico Carrino. So we have a lot of speakers, and every one of them is bringing a slightly different perspective that's going to help us have, I think, a very rich discussion about why actually it is unsustainable not to invest in long-term care. And so this first distinction I wanted to make is between economic sustainability, and we'll hear a bit more about that from Martin Knapp and Ludovico later. And I was looking up a definition, and the only one I found was that we spend up to the point where societal cost exceeds the value produced by spending. And this is already telling us something, which is that quite often when we talk about care, we are very good at talking about the costs of care, not so much about the value of care. And it's something we need to value and to understand how to even calculate it so that we can demonstrate what we can achieve through care. And that means understanding care outcomes, and it means having the tools to measure the outcomes of care and not just the cost. What we mean by fiscal sustainability, well, here is, again, the definitions are not as clear as you might think, but it comes down to how public spending compares to public revenue. And that we can break it down into how the growth in long-term care expenditure is rising compared to other areas of public spending and to public revenues. And here it's where sometimes there is this panic, population's aging, so we're going to have to spend more on care. But we also need to think that the long-term care sector is an economic sector that does generate some revenues, and people who are formally employed are paying taxes, unlike those who are in the informal sector. And finally, political sustainability. And I should say here that unfortunately, it's a shame that Mary Daly is not able to join us today. Unfortunately, she's unwell, but she was, and we will get her to speak on this at a future date. But here, when we think about political sustainability, perhaps what we need to consider is whether governments are spending in line with voters' expectations, whether the systems are meeting the social preferences and expectations of the population, whether the system is generating enough public confidence, does it target the right resources to the right people, and do people think that the care system will be there for them when we need it? And I think with this in mind, and this idea of political sustainability is perhaps a good way that I can hand over to Roberta, who's been looking at what people in different countries understand by sustainability when they think about long-term care. So all yours, Roberta.
Thank you so much, Adelina, and thank you so much for the invitation to participate in this roundtable. It's really a pleasure to be here to discuss about the sustainability of long-term care. And indeed, I'll try to contribute to this by giving some insights from the Let's Care project, a project financed by the European Union's Horizon Framework, in which we try to unveil the meanings of keywords in the long-term care, one of which was indeed sustainability. So in the different countries involved in the project, Denmark, the Netherlands, Lithuania, Austria, Portugal, Spain, and Italy, we asked, what does sustainability of long-term care mean? What does it mean in terms of content, but also what does it implies in terms of policies from the perspective of policymakers and stakeholders? And our findings indicate that in the content and conceptual boundaries of sustainability are rarely defined in practice. Sustainability remains an unclear, a vague concept, and most importantly, it's a polysemic one. Indeed, our research participants referred to different dimensions when discussing about the challenge of sustainability of long-term care, and they were the sustainability of long-term care financing, of long-term care work, the sustainability of existing configurations of care provision, and the environmental sustainability of long-term care. And these different dimensions were declined differently across countries, but also within countries, across types of stakeholders. Of course, I don't have the time to go in depth into the dimensions, so I will give you just two examples about the most recurrent dimensions that were mentioned. So the sustainability of long-term care financing and the sustainability of long-term care work. And for what concerns the former, narratives around these dimensions largely revolved around increasing costs and increasing public expenditure against fiscal constraints. So the fiscal dimension that Adelina just mentioned before. And of course, it comes with no surprise, I think, that this narrative was of particular salience in Italy, in Lithuania, in Portugal, and in Spain, where public expenditure on long-term care has never reached the 1% of the GDP in the last 20 years. But most importantly, the most important difference relates to the narratives that were used to explain, let's say, the causes of concerns about the sustainability of financing. So in Austria, in the Netherlands, and in Denmark, very rare discussions about the financial sustainability, the availability of fiscal resources were primarily associated with structural trends. That is the aging of the population, the increasing prevalence of multimorbidity among the dependent population, or even inflation. That is, they originate from, let's say, outside the long-term care system. It's about societal structural trends. Well, in the contouring countries such as Spain, Lithuania, or Italy, fiscal concerns were mainly associated with the existing fragmentation of the long-term care system among the health and the social sectors, but also vertically across territorial levels. So the main idea was that long-term care is deemed to be financially unsustainable, not also because of aging, but mainly due to the failure of the system in terms of governance arrangements. Because fragmentation creates conflicts, tensions, lack of coordination among actors, strategic behaviors affecting institutional compromises, and therefore the misuse of already scarce resources. Quickly, the second dimension of sustainability that was mobilized more frequently by our research participants concerned the availability of the long-term care workforce to address current and future demands, which shortages are seen as a major concern, of course, in all countries due to the existing employment and working conditions. So in this case, all stakeholders agreed on the inclusion of long-term care work as a key dimension of the sustainability of long-term care systems, although, and that's a key point, when talking about long-term care work, they refer to very different things. What long-term care work is strikingly differ across country. But on top of this, they stress two key points. First, they questioned the simplicity of the association, higher wages and better conditions equal more available labor, emphasizing the difficulties in attracting and retaining workers even when employment and working conditions are improved. And second, they also highlighted that, of course, improving employment and working conditions is seen as a part of the solution to address the unsustainability of long-term care work, but such improvement can exacerbate the fiscal sustainability of long-term care provision, increasing costs for the public administration, for private providers, for families and users in terms of higher taxes, but also higher co-payments in the countries where these apply. So stressing this tension between the fiscal dimension and the work dimension of sustainability. And this was particularly relevant in those countries with significant challenges in relation to the financing of long-term care and where long-term care work is comparatively more precarious. So these are just two examples, but what I would like to bring to the table is that when moving from the abstract level of sustainability as a policy idea to its day-to-day use, ambiguity and heterogeneity emerge. And in part, this is because there is little agreement about the nature of the sustainability problem. And this is because what the sustainability problem is varies, reflecting countries' diverse socioeconomic dynamics and long-term care configurations. So what does it mean in practice? What are the implications of this? Of course, that before translating general ideas into local context, it is important to reflect on and to make explicit decontextualized meanings and challenges of sustainability that long-term care systems are confronted to in order to identify meaningful policy solutions. So if in Denmark, the challenge of long-term care financing, for instance, is associated to aging, then it comes with no surprise that policy responses revolve around issues of autonomy, independency, re-enablement. But if we are in Spain or in Italy, then promoting autonomy will not be enough, or increasing public expenditure to the famous 1% of the GDP will not be enough, as long as the deep causes of the unsustainability of the system, that is, its fragmentation, are not dealt with. So I leave it here. Thank you so much again, and I look forward to the other presentations.
Thank you so much, Roberta, for giving us this context in which we are in different countries, people are thinking about sustainability and the priorities. So we're going to go next to Martin Knapp, who's going to bring us an economic perspective.
So thank you very much, Deed, for the opportunity to contribute today. And thanks very much to Adelina and Naz for organising this wonderful day. So I'm going to focus something on, say something about economic sustainability. So first of all, just to kind of set out the challenge, if you like, and the challenge looks a bit like this. So this is in relation to people with dementia, and it's the projected global growth in prevalence for a period from about now up till 2050. One of those big Lancet publications which does this really well. So we can see this growth. This is the kind of challenge, if you like, that many countries are facing. All countries are facing, some more rapid changes than others. What that then implies in a sort of economic sense, a narrow economic sense, is on my next slide. I'll come back to this one in a moment, my next slide. So this is from a completely different study that we conducted in England a few years ago. Adelina was heavily involved. I was involved. And what we did was to look at the projected number of people with dementia in England over the period from 2015 to 2040. Did lots of things with those projections, but one of them was to look at the costs. So in the left-hand column, 2015, those are the costs we calculated of supporting people with dementia. The labelling is wrong. The red bit is actually health. It says on the right-hand side that it's a different colour. But the red is healthcare, the yellow is social care or long-term care, the blue is unpaid care, the estimated costs that family and other carers of the time they put into the support. And then we projected what would be the cost in 2040 if you don't change anything. If the today's system or the 2015 health and care support system remain the same, what would be those costs? And you can see this increase of 249%. And the component increases there, particularly marked in both the kind of formal social care, long-term care system and in the informal, the unpaid care system. So those are the challenges, if you like, the economic challenges that every country has got the equivalent to this. So if I just go back to this slide, I think then what decision makers are asking are a number of questions. I'm just going to put up 5 of them here. So the first one is, what could and should be the responses to this kind of projected challenge? What can we do to better prevent people developing dementia or slowing down the progression? What can we do to treat the condition or care for people with that condition? Secondly, what does it cost to achieve good prevention, good treatment, good care outcomes? Thirdly, what are those outcomes? And that will include the economic outcomes, the sort of things that Adelina and Roberta were already sort of hinting at. Fourthly, how can health, long-term care and other systems, and it's important to remember other systems, which I'll come back to in a moment, achieve best value for money? Now, my background is in economics, and when I say best value for money, I mean something which is cost effective or efficient in an economic sense. So it's achieving the right balance between the resources you put in, so the costs and the time and the inputs from family carers and so on. It's the balance between those on the one hand, and then what you achieve in terms of better outcomes, better quality of life, better health for people with various needs. And it's not about savings. I mean, savings are part of that, but it's not just about whether we can spend money and save money. It's also about the outcomes we achieve. And the other question I put down here is, what incentives are needed to ensure that the best services are available? And some of the things that Roberta was saying sort of touch on that as well. What can we do economically in other ways to create the right incentives so that the best services are available to people with those current needs or those projected future needs? So those are all, I would say, they're all economics questions, but they're not just economics questions. Economics fits into those features in those questions, but doesn't dominate them, generally speaking. So I think we need to think about then 2 or 3 things. One is the direct benefits of long-term care. This is my not very sophisticated computer art, but hopefully you cope with that. So the direct benefits are these, and these have been hinted at already. We know that these services are not a drain on the economy. They are investments in achieving improvements, the sort of things I put on the left-hand side. Better health of those people who are identified as having long-term care needs, better quality of life for those people, prolonged independence in their ability to stay living in their own homes, which is pretty much everybody's preference, better social engagement, those sorts of things. Long-term care services contribute to community coherence. They're an important contribution to social capital in lots of ways. They support the quality of life of carers, family and other carers. They support the employment opportunities and employment achievements of individuals, either with long-term care needs or carers, and that has income benefits for them, and it has tax benefits for governments, of course. So there's a whole range of direct benefits of long-term care. What we have to remember, though, is that long-term care sits in the middle of a very complicated multi-sectoral system. So I put in a number of things there. Those are all other sectors which have connections to the long-term care system. I put health, education, depending on the age of the people we're talking about, but a whole range of things. So there is this sort of very complicated multi-sectoral system. An individual with long-term care needs does not compartmentalize their lives into these different areas. These are intrinsic to their everyday activities and the achievement of everyday and long-term quality of life. So we have to think about investment in long-term care as firstly having those direct benefits I showed you on the previous slide, but also having what an economist will call spillover benefits in perhaps other sectors. And I'll show you some of those in a moment. Now, just pick up again, what is then crucial in the long-term care context is then making sure that there's good coordination across those different sectors. And probably every country that's featured in the webinar today, and people are joining from every country, has tried coordination in various ways. And probably every country has had some failures in that respect. It's very difficult to coordinate across those sectors. Let's go to these sort of so-called spillover benefits. What are these connections? And let's give you 4 examples. So good long-term care services, good investment in those services will undoubtedly reduce pressures on healthcare systems. Sometimes, and this is the case, unfortunately, sometimes in England, social care is seen by many people purely for its knock-on benefits for the healthcare system, but it needs to be seen as front and center in people's lives. But it does have important implications for healthcare systems. Secondly, what long-term care can do is to support people back into work or allow them to continue in work, whether that's the person with the need or the carers, and they're paying taxes, they're contributing importantly to the economy. Thirdly, long-term care can help to optimise the use of available housing, think about ageing in place and other such initiatives, supporting the preferences of people with these needs to stay living in places which are important to them and give them tremendous quality of life. And then the fourth example is, of course, by supporting the employment aspirations of individuals. That reduces the reliance on the welfare benefit system and the social security system, and that is another fiscal advantage which governments appreciate. So my final slide is then just to show you this. So we have a project that we have been running for a few years now at LSE called the Essence Project, the Economics of Social Care Compendium. And what we do is not a project which is collecting not generating new evidence. What we do is identify evidence, economic evidence, and sometimes create it through some kind of modelling activities. But we generally pull together economic evidence on long-term care services, not just for adults, so social care for adults and for children, and then try to package that evidence in a way which is accessible to people who are not economists, not knowledgeable in the expert technical area. So if you're interested in this, I put the website address at the bottom there. If you're interested, do have a look at that. And I'd be particularly delighted to have any comments on it, because we've just recently started the new phase of the project and we're keen to do things which are helpful to the community. And so with that, I'll go back to this beautiful seascape and say thank you very much.
Thank you very much, Martin. And you're taking us all away with that photo at the end. I'd like now to move to demography. So we're going to hear from Jeroen's speaker on perhaps a new way of thinking about the demographics of aging. All yours, Jeroen. We can see your slides.
Okay, you can hear me as well now?
Yes.
All right, good. Thank you very much for inviting me.
Back. If you can project it again. Yes, perfect.
Yes, good. All right, I'll start in. So my talk is called Rethinking the Population Aging Time Bomb, Balancing the Contribution and Dependency of Older People. So we know all about the aging time bomb narrative. The more older people, fewer workers, exploding costs. But when we look at who is actually dependent and who actually is contributing, using better measures and better data, the picture might actually change a bit. So most current approaches to aging ignore the continued rise in life expectancy in the diversity of the experience of aging in later life. So the standard indicator of population aging, as we all know, is the old age dependency ratio. So everybody above the fixed age, usually 65, is treated as dependent, and everybody 16 to 64 is being productive. That's problematic for two reasons. So life expectancy has risen dramatically. So over now, a 65-year-old today is much younger in terms of remaining life than, say, a 65-year-old 50 years ago. So many people of working age are not actually in work at all, and many over the age of 65 are still actually working or volunteering or providing intensive care even. So in the British Medical Journal paper, in the time bomb that isn't, like you saw in the first slide, we therefore define dependent older people as those with 15 years less of remaining life expectancy, and divided all them not by just all adults age 16 to 64, but by the number of people that are actually in employment, regardless of age, labeling this indicator as the real elderly dependency ratio. With these adjustments, the ratio actually rises a lot much later, and say, for instance, even in the US, only very, very recently. Moreover, it's influenced by economic booms and busts. So when employment is high and more people are available to fund the welfare state, as what happened in Spain, say, in the mid-1990s to 2007, just before the economic recession, we see that many of the working age, then after that we had the big crisis. So you saw that many of the working age exit the labor market and were not active at all, which would increase then this dependency ratio, and not dependent on just age itself, but also by the employment. Because in these cases, when there's an economic crisis, you have working adults that are not contributed to sustain the welfare state system. So the classic narrative that is based on a fixed age threshold overstates how many older people are truly dependent and understates how many working age adults are not actually sustaining the system. So the second thing is to look at not just dependency, but at the contribution of older people. So in the myth of old age, in this paper, we analyzed the UK data on health, economic activity, and poverty and unpaid work. And one key finding was that older people contribute a lot via unpaid work. So in the 2017-18 Community Life Survey, people aged 65 to 74 had the highest rates of both formal and informal volunteering. And even among the 75 plus, just one in 4 did formal volunteering, and about 1 in 3 informal volunteering at least once a month. So formal volunteering would be like in clubs or churches and stuff, and informal would be, for instance, caring for the grandchildren or caring for an elderly spouse. So according to the 2011 census, nearly 1.2 million people aged 65 plus provided unpaid care in England, and older carers were the most likely to be caring 50 or more hours per week, so often for a spouse. So many of the early retired are not happily idle, and they are actually running local organizations, supporting their family and delivering intensive care. In that sense, they've earned their retirement and often continue to give back well beyond pension age. So in my last slide, let's not ignore the coming age, the care gap, as we will have fewer informal carers. So in a study for Spain, we used a mixed microsimulation and an agent-based model to simulate the family networks and care flows for the cohorts between 1908 and 1968. So Spain is an instructive case because about 80 to 90% of older people receive care at home and still rely mainly on informal family care, especially partners and daughters. At the same time, fertility has been well below replacement levels for decades. Childlessness is increasing as well, and women's labor force participation has risen strongly because of women that usually take care, do the caring. So, however, the model shows something counterintuitive. For the oldest cohorts, the family care deficit was actually larger, largely because of the high widowhood. So many very old women who live without surviving spouses. But for the younger cohorts, we foresee a new type of deficit, more the 1968 one here on the right. So more couples surviving together into very old age, but with fewer or no children, and adult children are more likely to be in full-time work. So in future, we'll see more situations where both members of an older couple are dependent, and there are few or no adult children available, or they have a strong work and childcare commitments. In these situations, family care alone cannot cover the hours of care required. So the conclusion is clear. Even if older people are not an economic time bomb, demographic change is creating a structural care gap that families cannot bridge on their own. That brings me back to today's question. Why is it unsustainable not to invest in long-term care? Well, the fiscal time bomb is overstated. So when we account for rising life expectancy and actual employment, the burden of older people has not exploded. The contribution of older adults is systematically undervalued, and they are major providers of volunteering, care, and financial transfers. And in many countries, less likely to be poor than younger age groups. So the real unsustainability lies in relying on the shrinking informal care. Smaller families, small childlessness, more women in paid work, and more couples living to very old age together mean that the traditional free care model is breaking down. So investing in long-term care, professional services, community-based care, and support for informal carers is therefore not a response to an exaggerated aging time bomb, but a necessary adaptation to demographic and social change, in a way of considering what older generations have contributed and still contribute over their lifetimes. Thank you.
Thank you very much, Jeroen. That is a very helpful framing and helping us as well with this demographic time bomb myth, but also the realities of what we need to be prepared for. Thank you.
Thank you.
And we're now going to move to a completely different perspective on sustainability, we're going to hear about environmental sustainability and long-term care. And I'm really delighted to welcome to the floor Andrea Schmidt, who's really been one of the first people to start working on this topic, as far as I know, and helping us think it through. So Andrea, all yours.
Thank you very much for the invitation and for putting this topic to the table. I also prepared some slides to help also the participants go through this topic, as it might be new to some. So let me just check how I can do this. Okay. No. So the topic I was asked to talk about is environmental sustainability. I would like to reframe it a little bit to also include socio-ecological sustainability in long-term care into this talk. And I must say that while as you're going to hear, when we talk about environmental sustainability, we usually talk more about climate mitigation, so the reduction of CO2 emissions. I would really also like to highlight that climate resilience is a broader concept, and this preparedness to the impacts of climate change and the potential for transformation that comes with it should be always included in my perspective and based on my work so far when we talk about this topic in long-term care. So now I cannot change it, so maybe you will have to help me. Let me see how I can do this. Actually,
it's changing. We see the second one.
Okay.
Yeah.
Together with my colleague Ernest, we also published a book chapter in a forthcoming book. So feel free to read up a little bit further on this. And we also published a policy report for the Austrian Ministry of Health in German that is also available online. So feel free also to reach out to me if you speak German and want to read it. Now, what is the rationale of? Okay, let me start with the definition. So it's one frequent definition of socio-ecological sustainability, and sustainability is based on the UN Brundtland report that refers to meeting the needs of the present without compromising the ability of future generations to meet their own needs. So you can see that there is a strong intergenerational perspective here. And the second perspective is brought in by Ian Gough by saying that the planetary boundaries should be addressed also within the context of welfare states. So let's take these two aspects when we talk about socio-ecological sustainability, as I cannot go into more detail for time reasons, and give you just a brief overview of the rationale why we talk about this environmental sustainability. So climate change and CO2 emissions are impacting on population health and cause increased needs for long-term care recipients. Think about extreme weather events, but also the chronic burden of heat and what it does to people with heart conditions, how it is increasing inequalities. Think about people living in precarious housing or with not sufficient ways to insulate their homes. So you can see it's about acute and also chronic burden of climate change. And this leads to possibly higher demand for health and long-term care services, which of course in turn has also implications for the workers in long-term care organizations and the healthcare system and social work as well. And another aspect here to consider is that health systems, as you will hear a bit later, themselves are also responsible for CO2 emissions. And I have to say that the numbers on how large are the carbon emissions of long-term care systems are not very clear at the moment. There's one study from Germany that I'm going to show. And we must say also, generally speaking, that care work is, of course, a relatively low carbon activity, even though it is important that long-term care organizations adapt also frameworks to increase environmental sustainability. But I'm trying to bring this together in a minute. So there are different ways how we can act on these different rationales. On the one hand, of course, the first one would be to improve population health at large, reducing health inequalities so that long-term care needs occur later and are not unequally distributed. So health promotion is always one of the main kind of levers also, because it makes us more resilient, as well as reduces CO2 emissions by basically not making people need any care. And then, of course, it's about preparedness and adaptation, and it is about lowering emissions. And now I'm going to talk about the ecological footprint of the long-term care system very briefly. As I said already, healthcare systems account for about 4% of global carbon emission, and it is estimated that long-term care accounts for about 1/5 of those 4%. So, and these emission sources refer mainly to energy demands in buildings, but also staff transport, single-use medical products, waste management, but also food systems. And as I said, the only study that I know where this has been quantified is the German health and long-term care system. For those who do not speak any German, no problem. I put the names of some of these aspects here on the right side in black. So you can see that the highest emissions occur in hospitals, and the different colors basically mean where these emissions occur along the procurement processes, along production processes, wherever they are assigned to. There are different ways of calculating these emission intensities. And whereas residential care and daycare are quite a bit lower in their emission intensities, as well as mobile long-term care. So this is just to give you a flavor. Where do we stand when we talk about environmental sustainability in long-term care? And I'm happy also to go back if you have any questions. I quoted also the report in the references. And but what I would like to highlight, and what we also did in our book chapter, is really also to think about systemic ways forward, how we can integrate environmental sustainability as a value that is closely aligned also with other gerontological values, ethics, intergenerational ethics, and how we can integrate this environmental sustainability, but also climate resilience into our long-term care systems. Because one of the things that I keep repeating is we cannot have a separate debate on climate change and environmental sustainability. We must have this debate within the policies and the systems that we already have. And so there are 3 points that I would like to conclude with. And the first one refers to what can be done within organizations. There is the concept of transformational leadership that could also include disaster preparedness and ecological sustainability, preferably also by involving people in need of care and older people and informal caregivers in how these concepts are being designed, as well as considering the already poor working conditions in the long-term care sector. So I think when we talk about transformation, this is always something we need to keep in mind. The second point is really refers a little bit to what the colleague Flavia was saying before. So to have really also innovative models for aging in place. The one idea that we are putting forward here are shared housing solutions in walkable neighborhoods. So not really promoting aging in place as the one solutions where older people and people in need of care live in single houses, but rather are living together and have co-housing solutions, because it might address social isolation, will make them more resilient and reduce also emission needs. And then the third, and happy to discuss what you think about this idea. And then the third one is urban development models. Think about green zones in heat vulnerable areas with barrier-free accessibility, which could also increase older adults' physical and social well-being and contribute then to broader sustainability goals. So these are the references, and thank you very much for your attention.
Thank you so much, Andrea, for bringing these perspectives and making us all think. I should also mention that we will have we do have an interest group led by Andrea and colleagues on long-term care and climate change at the Global Observatory of Long-Term Care. And in fact, one of our first events is going to be in collaboration with another group that's looking at continence care. So in early February, we're going to be looking at the role of changing, potential changes in improving the environmental impact of continence care, particularly in nursing homes. That will be the 2nd of February, and details available soon. And now we're going to move back to Australia, where we started today. And Nicole, thank you so much for staying up. And you're going to bring a business perspective and a sector perspective on sustainability. The floor is yours.
Thank you very much, Adelina and Naz, and thank you so much for the opportunity to talk with you today. And thank you also for your framing of the different dimensions of sustainability. And it's interesting. I was reflecting that in what I was hoping to talk today, and I will continue to talk about, is the role of the narrative that is happening in Australia right now around fiscal sustainability. But on reflection, this is a very live issue in Australia, and I think this also talks about the intersection with political sustainability and the changing frames around the sustainability that's happening and been happening most recently. So it might be helpful just to provide a little bit of context in terms of long-term care in Australia. The system in Australia is funded mainly through the general taxation system, which is predominantly income tax from people who are working. The Australian long-term care system is characterised by universal access, which is eligibility based on age, in which older people are matched to appropriate support services based on a needs assessment, much like elsewhere in the world. I probably, on top of that, it's not on the slide there, I would note that Australia has some fiscal handbrakes in terms of supply controls by the government, which will limit the number of funding entitlements, be it either places in residential aged care or the number of packages that support individuals in home care. Although more recently, and we've got a new Aged Care Act that is 28 days old, and in it, it's a right-based legislation that requires the government now to provide equity of access. And so that is placing some stress on those supply controls. Another kind of feature would be that the Australian aged care system is heavily subsidised by the government. You can see the sorts of rates there on the slide. And so I guess this has kind of led to some graphs like what has been spoken about before, that we're looking where Treasury is putting a forecast around the percentage of GDP spending on aged care. It's one of the big four in the coming couple of decades, and that doesn't even include the government expenditure on cash payments to seniors. And in what perhaps I'd like to highlight right now is that this has perhaps created a little bit of a contest of narratives in Australia. On the one hand, there is perhaps expectations of maybe entitlement, a view within a community that I have paid taxes all my life, and so I expect to be able to be cared for and for the government to pay for that. And this is butting up against also what is being framed as an intergenerational equity issue. In Australia, like in many countries, there are many younger people who are struggling with cost of living and housing affordability, and perhaps this is raising questions about the extent to which it is fair to publicly subsidise a system that supports older people, particularly, and again, anything Australia's got to do with real estate, when several, not all, older people have significant wealth tied up in their housing too. And so this has perhaps created what I said before, a very live debate about fiscal sustainability. So a few years ago, there was a sustainability task force, and they put forward several kind of recommendations and principles. I'm not going to go through all of it today, but what is interesting is those things have been accepted by the government, and we're now seeing that flow through not only in programs and policies, but also again in the narrative of how this has been framed. So One of those principles, and it's perhaps not surprising at all, given we've heard for many other countries as well, is a great emphasis on providing support to ensure that those who can, wish, and to safely age in place can do so. And so that's reflected in a program by which there's a great emphasis now on in-home care in Australia. Now, Australia's had in-home care before, but the emphasis probably has been on residential care. And so it's a system now that will support roughly 1 in 3 older people to have some form of home support, and in particular a fast expansion of the complex care support that's provided in home. Now, this again, in one sense, has some things that make sense from a fiscal point of view, and also it's really important that it aligns with individuals and communities' needs, that people be able to age in place. It's a very new system in one sense. It's been fragmented before, and it's only, like I said, 28 days old, and it's got some initial teething issues in terms of the supply is not keeping up with the demand. But I guess there's also, in one sense, we are seeing, in a sense, it is representing a shift in Australia, again, away from residential care and much greater emphasis on in-home care. The other key component that came out of the task force was a principle about the sharing of costs. And so the overarching principle was a desire for aged care funding to be easy to understand. I like that one. Equitable and sustainable. And that was that was accompanied by the principle 3 that I've got there on the slide, that articulated, I guess, a little bit more in terms of what a fair sharing of costs would be. And I probably would kind of pull out 2 themes in the way in which the sharing of the fiscal costs is framed. One was around paying for what. And so there's an articulation that whereas government would be the main funder of care, and within that be clinical and to some extent personal care, that there would be an expectation that there would be more co-contributions around areas of personal responsibility, things that people presumably pay for in other realms of life, such as everyday living costs, and for those in residential care, their accommodation. So there's a split in terms of the type of service, but there's also a split in terms of who pays by how much. And so a sense that those that have the financial means to contribute more would be asked to contribute more as well. And so concretely, this is reflected, these ambitions, and in that, the government would continue to pay safety net funding for those of low means. Now, that ambition is now reflected, for example, in the co-contribution rates that exist with that support at home program. And you can see in that table there that the co-contributions rates are calibrated in 2 different ways. One, by the financial status of an individual, and moving across in the columns in terms of the types of services that they're using. And similar things were brought in for residential care, but a little bit more complex. But these were also to be sold, were accompanied by some extra safety net provisions in terms of lifetime caps and no worse off principle. I guess, again, this is very new. It's an emerging space. And there are some anxiety. There's some anxiety about that this sort of model might actually discourage use of more preventative supports, and perhaps encourage more unnecessary use possibly of clinical care. It also has created some interesting debates about what counts as independence, and there's been a lot of debate about, for example, showering, which is counted as independence, and now concerns that maybe those who can't afford it are going to start rationing the amount of showering support they're accessing. And I think there's also starting now, because of the status, some emerging questions about what it actually means to be low means as well. But nonetheless, I thought I'd throw this into the mix as, again, an intersection of the political and the fiscal sustainability, and being able to see how this plays out. I think it is interesting to see how, in one sense, there's a lot here about fairness and equity as a framing for sustainability. And it will be interesting to see how this is reflected in different community attitudes around long-term care in Australia as well. Thank you very much.
Thank you so much, Nicole, for this perspective and for introducing both the new Australian reforms and this convergence or dissonance sometimes between fiscal and political sustainability. Thank you very much, and thanks for staying up so late as well. Unfortunately, Roberta had to leave due to a family emergency, so she won't be able to join us for the discussion. And now, last but not least, we have Ludovico Carrino, and Ludovico has been one of the editors of a new book published by the European Observatory of Healthcare Systems called The Care Dividend. And I think this gives us a bit of an introduction already to the perspective on sustainability that he's bringing. So all yours, Ludovico.
Hi, Adelina. Good morning, everyone. I hope you can hear me well. Otherwise, let me know.
You.
Okay. I'm going to share my slides. Whether this works.
Yes, we can now see it perfectly. Thank you.
Oh, okay, perfect. So I have the luxury of speaking as last speaker, and Professor Martin Knapp already has paved the way for the concept that I'm gonna try to describe with this presentation that brings together reflections and papers, chapters that have been published in a book called The Care Dividend. So I'm going to be quick on the introduction because I think Martin Knapp has done an excellent job, and I will perhaps give you a few examples. I can be very quick on long-term care, which is support for people with some functional cognitive decline. This is very important to clarify. This is not support for people with only for people with extremely severe functional cognitive problems, but it's a broad definition. And as others have already pointed out, we face slow economic growth, high debt, high public debt, shrinking workforce. So there is this question on whether does it make sense to spend more public money on long-term care, whether this is effective, whether this is desirable. This is broadly for welfare spending, but for long-term care, I think in particular, because long-term care expenditure is pretty low. We know that what matters for economic growth and what can hamper economic growth, which is very concerning for governments, is not age of the population, but it is rather the health of the population, health of the workforce, the level of human capital, the level of social capital. And the last point that I want to make clear before, which is at the core of this care dividend concept, is that lives are intertwined. People live together across generations. So the intergenerational effects, which have been already mentioned many times, are natural. They happen. That we analyze them or not, they are still there. So there are many spillovers that Martin was referring to. The take-home message from this presentation is that the effect of long-term care, and therefore the effect of investing in long-term care, goes well beyond helping older people with disabilities. It has a lot of other effects. And what we argue in this book, we put together different perspectives that try to, let's say, argue that long-term care, investing in public long-term care, could be also private for that matters, but we know public investment as a strong advantage. It unlocks lives. It unlocks the lives of the older care recipients, and it unlocks the lives, the possibilities, the capabilities of their families and the care network, especially the informal care network. And through this, this leads to benefits that have been mentioned, benefits to health systems, stronger foundation for economic growth, especially through employment participation, labor market participation, and education of the workforce. And of course, new markets, the formal workforce that would increase, but also benefits to household well-being, especially reduction of poverty, reduction of perhaps gender inequalities, and overall benefits to societal well-being with less intergenerational inequalities and more social cohesion. An example that I think I can spend a little bit more time on this because Martin has already discussed most of these effects. So public investment in long-term care could improve the formal support for a vulnerable old person. And that could be it. But actually we know, and we have research that now empirically demonstrates it to causal evidence, that the formal care support improves the older person's health. So it reduces, or it at least stabilizes the frailty situation, and it reduces the risk of catastrophic costs that people would otherwise face. Now, this, again, doesn't stop to this individual, but this individual doesn't live alone. It lives in a society. So this individual will have probably lower hospital use, and there is, again, as Martin said, empirical evidence on that. And lower hospital use means better, more efficient public spending on healthcare. Therefore, probably healthier public budgets. At the same time, having more formal support will probably free the time, or at least give more freedom of choice to the informal caregivers on how to spend their time, what type of care to provide to their old person, to their older loved one. And this will affect the work participation of these people. And this will, together with the reduction in poverty that I already discussed, which of course doesn't stop to the old person, but to the frail person, but it has spillovers on his or her families. This will altogether stimulate economic growth. We are talking about the foundations of economic growth, especially work participation. And the economic growth can provide support through, in a lot of mechanisms, through public budgets. There is also another perspective that I'd like to mention. So what happens if we don't have a strong public system of long-term care? Now, we live in a world when governments want people to work longer. What happens when adult workers work longer? Well, we know what happens. Prolonging working lives, for example, through pension policies, will affect the time that these people have to provide informal care. And we know that adult workers, 50 plus, are really crucial support, crucial provider of informal care. Now, we have evidence that shows this. Prolonging work will reduce time for informal care, especially for lower socioeconomic status people. This will not stop there. This will translate into lower care access for the older person. And again, there is evidence that shows that older people receive less care if the adult workers, when the adult workers work longer due to pension reforms, and there is not a strong long-term care system that supports them. And all this could have other, this time, negative ramifications on costs, on health, on frailty, and so on. So to summarize, let's say, the long-term care, investing in long-term care, public investment in particular, can improve the life of care users, expanding their capabilities, reducing poverty. It can benefit the health system, as it has been said. Through families, it can have spillover effects on well-being and growth. Also, for example, thinking of young caregivers that face important challenges in developing their human capital. And of course, job creation in the formal workforce, new sectors, innovations. This has been discussed. So in conclusion, we argue long-term care should be seen as a strategic infrastructure. Investing in long-term care also helps people who have nothing to do with the long-term care. And this can be economically, economic benefits could be very meaningful. It should be taken into account when running a cost-benefit analysis. So we argue that care is a societal cost, and there are very important social costs of neglecting this. And I think I can stop there from this introduction. Thank you.
Thank you so much, and I'd like to thank all the participants, because you've all been really good at sticking to time, and that means that we now have the luxury of having a bit of a discussion. I think, so thank you very much, and Ludovico, I think you really rounded up very well the argument and the case for investment in long-term care. So I think. But the way I'd like to do this is we have a few comments already in the chat. I haven't seen direct questions, but there are some comments on the importance of walkable neighborhoods, but also the importance of making sure that home care, for example, is structured in a way that takes into account how to get from A to B and prioritize their role. if you have any specific question, you can put your hand up. And in terms of the members of the panel, please feel free to unmute, and I'm sure you'll have some comments to each other's perspective. I'm very happy to hear them.
I have a comment. I'm not sure how to raise the hand.
That's
Can
okay.
I go ahead? So I can raise hands physically, but in a way. Okay. Just a very brief comment on discussing what policymakers think about the sustainability of existing long-term care systems. Thinking about the Italian case, which now I'm studying a little bit more carefully. There's also a reform ongoing in Parliament. It's a bit ironic to discuss the fact that long-term care systems, as they are not sustainable, because many times long-term care systems are very, very small, actually, very weak, very underdeveloped. So I think there needs to be really a change of perspective. It is unsustainable, not because as it is, it will be too costly, but because as it is not providing help, and probably we're not using well public money, which is scarce and very tough to allocate this time. So just this reflection, I'm gonna stop here.
Thank you, Ludovico. And I think it was very interesting how the work from Roberta, who unfortunately had to leave, was showing how in countries with very fragmented and not very well organized in terms of systems, the fragmentation is a real issue to the broader sustainability of care. I see some nodding, and but feel free, the panelists, to unmute and jump in. And if I see any hands, I'll bring them up.
I can quickly maybe comment on that, because I also think that it's really, it was quite interesting what Roberta reported about how these aspects of governance, financing, but also she mentioned also environmental sustainability. She didn't elaborate on it, but how these really are linked together very much. And and I do think that that's actually the way to go when we talk about sustainability. I tried to also highlight that when I was talking about the care models, and would be also really happy to hear, because I think there is a little bit of a conflict also there, because for example, when the colleague from Australia was presenting on how there's a lot of investment in home care and aging in place, which is great for many of the care recipients. But then when you bring in, for example, the environmental sustainability perspective, you could also see it from different angles. So but in general, just to agree on the point made.
Thank you.
I have a question, if I may, particularly because we had at least two different speakers talk about make very compelling cases for the externalities, the positive spillovers of investment in long-term care. In fact, I think many people are making really good arguments in this forum. I guess I'm interested in how, and it's perhaps a naive question, but how then, if these externalities exist, okay, so then how does the narrative change? How do these externalities realized as part of the investment, so that when people are considering long-term care, they're not just focusing on a graph like was in my presentation as well?
I'm going to jump into this one and say that, I mean, for many years, in fact, with Martin, on looking at dementia care and looking at and trying to estimate the cost of family care. And the thing is that traditionally, the way it's done, and the way it's done in most economic evaluations, we only look at the impact of the cost of the care that is provided while the person with dementia is living and while the care is being provided. And we now have very clear evidence that, for example, the cost of unpaid care last much longer than the period during which care is given. And there are some real impacts due to labor market frictions in terms of people not being able to return, especially those of working age, to the jobs that they had and at the place where they would be if they hadn't taken time off. So maybe their skills have become out of date, and maybe there are difficulties getting back, especially if women in their 50s. It's not so easy to get a job after being out of the labor market. And this has real fiscal implications. It has implications for the pensions of these women. And it's only very recently that there's been some data showing this clearly. And I think it's a really important example. And I also just, before I hand over to Martin and Jeroen, I read a question from Kyle Sinkering, who is also highlighting the fact that in many countries, non-existing long-term care services have led to the development of living carers and a big impact as well on the populations of both the countries of origin and the care that is being provided. So I'm going to hand over. I don't know who was first, Martin or Jeroen. Maybe Jeroen, you're on the left, so maybe it's you.
All right, okay. No, thanks. Yeah, just make an extra comment. I mean, what I found when I was doing some research on this population aging bomb or not, I realized that population aging itself is a lot slower in terms of how many extra elderly people we have in society compared to, say, GDP growth. So economic growth in general is faster than population aging. And so the whole idea that it's becoming unsustainable, healthcare in general, especially related to aging, I think is due to other things. It might be especially the economists under us, I guess, not myself, I'm more of a demographer, but to sort of find out what aspects is really making it so unsustainable. Is it the cost, for instance, I've been living in Spain now for 23 years, and I know that informal care here, it's probably some way is sustainable in the sense that we get very cheap really cheap informal carers, often illegally from South America. So Latin Americans are doing a lot of the caring here, and Moroccans as well, women. So the costs here are relatively low for informal care because we don't have very high wages that you might have in Northern Europe, or especially in the US. The US doctors are getting paid, some of them are getting paid $500,000 a year. We don't have it in Southern Europe. So what part of that increasing costs are really due to the increasing wages, increasing diagnostics, improvements in medical care as well, all associated with all these additional costs, but are not related to the actual increase in population aging of the population itself, but more due to all these other factors that is making it so much more expensive. That was just my comment, really. And maybe one of you can answer that.
Thank you, Jeroen. And I think it's really important, these different perspectives in different countries based on the state of the economy, the nature of employment, and the wages. Martin, do you want to come in?
Yeah, two things really. So one is on the sort of former carers, the longer term impacts of being a carer. Just a little comment, which is two of my colleagues at LSE have got a really interesting research proposal to look at that, but they're having difficulty finding a funder that would be interested in funding it. So I think this is a topic that many of us recognise as important, but finding a home for the research is not straightforward. So then the second thing is it goes to Nicole's question about these external consequences and how to factor them in. And this is a sort of age-old question in economics. You might want to try and internalize, as economists would say, bring some of those other agencies into your system in some way. That will be very difficult in a long-term care context. So I think then it's a question of finding ways of joining up these different silos or breaking down these silos so that there are, collective or coordinated actions. And that is far from straightforward. As I said very briefly, I think probably every country has got a history of failed attempts to integrate social care, long-term care with healthcare, with housing and so on. So maybe another study is somebody looking for the successes across the world and then broadcasting those, because I think this is clearly going to be the future challenge, particularly because across the world, governments are putting more and more responsibility away from the collective responsibility onto families, onto individuals, and that creates another set of silos. So I haven't got a solution, but I can see a research agenda. Sorry.
And I see lots of nodding to this. There's a comment, I think we'll probably end up with this, from Andrea, which is about the formalization of informal care. And thanks for making that point. And actually, this is a nice segue to our next speaker, who's going to talk from a country, from Denmark, where there's a much higher proportion of formal care than in other countries. And I think one interesting policy development we're seeing is in quite a few countries, and we're going to share a report on this soon at the Global Observatory of Long-Term Care, on how different countries are also considering the profession, so treating unpaid carers, in some cases at least, as professionals, in the sense that they get a contract of employment with holidays, with a pension, and all the other rights that people have in the formal labor market. It's not yet very common, but in some countries they're beginning to have some provisions of that nature, and of course that completely changes the nature, but also the spending on care. But on the other hand, it may be a recipe for not having so many older women on social pensions. That is also a big cost. Anyone would like to have a final word before we? Yeah, so I think from me, a very big thank you to the panelists. Thank you so much for such an engaging and wide-ranging discussion. It was a very short amount of time, but I think it's been incredibly rich. And our idea is to gather some of these perspectives and come up with at least a paper of some sort that will help us, I think, in making progress and how we're thinking about sustainability and long-term care.